My name is Dr. Jess Schmid. I am an otolaryngologist. Otolaryngology, or ear, nose, and throat surgery, for me was really a love of the communicative sciences. And what I mean by that is, as I went through medical school and sampled what each specialty had to offer, I was thinking in my head, how am I affecting patients' lives? Ear, nose, and throat surgery for me was a field that I quickly came to realize we affect every way in which people perceive the world. In the head and neck, we have sight, we have taste, we have smell, touch, and hearing. I saw surgeries that remove excess tissue or repaired muscles in eyelids to help people see again, removal of tumors from the head and neck that affect how people perceive you, disorders of the voice being treated, and then one of the surgeries that I'm actually most passionate about, hearing restoration surgery. That's all in the head and neck, and there's no other specialty that boasts the ability to do that, and I was instantly in love with it. The fact that this system was a nonprofit organization was really attractive to me. It may be a bit naive, but one of the biggest reasons I got into medicine was the simple idea of helping people. I didn't like having to think when a patient would walk in the room about insurances or payment model or any of that. In the end, I just wanted to be able to walk in and help someone, and I can do that here. What you can expect during a visit with me is eye contact, not being on the computer during the whole time, and a visit that's really geared towards providing you the most efficient, valuable care that I can give you. The way that that starts is when you first walk into the room, I'm going to cover your past medical history, and everything that I see about you in the computer, I always want to verify it with you and make sure that you two are in agreement. After we've covered that, and I'm sure I'm not going to miss anything, the next thing we'll do is get into the reason why you're here. And I want to hear it in your own words. And so in a way, I expect you and I enjoy that you tell me a story. After we figure that out, I'll go through a full comprehensive head and neck examination with you. And then is potentially the most important part of the visit, which is the recap. I like to take things that are, a whole textbook's worth of information and distill it in a way that's very clear, excellently communicated, in a way that you can repeat back to me, that you understand what we're going to do for you, whether that's diagnostic tests, a surgery, a medicine, or any other treatment or diagnostic modality. Outside of ear, nose, and throat surgery, when I'm at home, the biggest thing that I enjoy doing is spending time with my wife and kids and being involved in our local church. Those are the three things that kind of make me tick outside of work. And so we spend time with lots of friends, try to have people over for dinner. My wife and I love going on dates. We love hiking, biking, doing outdoor stuff, going out to eat. And then I have two small kids right now, so I'm kind of into whatever they're into. Whether that's playing with Legos or hitting the ball out in the backyard or just putzing around in the garage trying to put things together. That's what eats up the majority of my time. Aside from that, I'm a pretty standard Midwestern guy. I like shooting sports, I like fishing, and then building things in my garage. I've built a few pieces of amateur furniture, and I like to tear apart electric motors and see what I can make out of them. So just tinkering, really.